The blood pressure number that protected you at 45 may not be the number that protects you at 75. And this is where a lot of older adults get misled. Because when most people hear ideal blood pressure, they immediately think 120/80. But after age 70, that number can mean two very different things. For one person, it may be excellent. For another, it may be the exact reason they feel weak, dizzy, foggy, or unstable on their feet. Today, I want to show you why that happens, what changes in the body with age, and what blood pressure range often makes more sense as you get older. And by the end, I'm going to share the single mistake I see older adults make when they focus only on the cuff and ignore what their body is already trying to tell them. Let's start with what actually changes inside the body, because this is the part almost nobody explains clearly enough. When you're younger, your arteries are more elastic. They expand and respond quickly when your body changes position, gets dehydrated, or suddenly needs more blood flow. But with age, those blood vessels gradually stiffen. That stiffness raises systolic blood pressure over time, which is one reason top numbers often creep upward as people get older. But the bigger issue is not just that pressure rises. It's that the body becomes worse at adjusting that pressure moment to moment, especially when standing, after a hot shower, after a large meal, or when you haven't had enough fluids. And that leads to one of the most overlooked problems in older adults: orthostatic hypotension. That's the drop in blood pressure that happens when you stand up, and it's generally defined as a fall of at least 20 points in the systolic number, or 10 points in the diastolic number within about 3 minutes of standing. That may sound technical, but the feeling is very familiar. You stand up, and for a second the room feels hazy. You feel lightheaded. You need to grab the chair, the countertop, or the wall. In a younger adult, that may pass quickly and mean very little. In an older adult, that same moment can become a fall, a fracture, a hospital stay, or the beginning of lost independence. This is why the idea that lower is always better becomes dangerous when applied too casually after 70. High blood pressure absolutely matters. It increases the risk of stroke, heart attack, heart failure, kidney disease, and cognitive decline over time. That part is still true. But what's also true is that some older adults are harmed not by untreated blood pressure, but by blood pressure that has been pushed lower than their body can safely tolerate. And that tolerance is not determined by a chart alone. It's determined by symptoms, resilience, frailty, medication burden, hydration status, and what happens when they stand up and try to live a normal day. Let me make this real with two very different 75-year-olds. Imagine the first person is active, walking daily, mentally sharp, eating well, tolerating medication without dizziness, and never feeling unsteady. If that person has a blood pressure in the low 140s, there's a very reasonable argument for treating it down further, because studies like Sprint showed that selected older adults, including many over 75, benefited from more intensive control with fewer cardiovascular events and lower mortality. But now picture a second person, the same age, who feels weak when standing, has already had a fall, takes several medications, and seems more fragile overall. For that person, chasing the same target can create more harm than benefit. Same age, similar reading, completely different physiology, completely different risk. And here's the nuance that matters even more. The major study people love to cite for aggressive blood pressure control did include adults 75 and older, but it did not represent every older adult you and I see in real life. Sprint excluded people with diabetes, prior stroke, and many frailer patients, and it used a specific automated method of measuring blood pressure that often reads lower than routine office checks. So yes, intensive treatment helped many healthier older adults, but that does not mean every 78-year-old with dizziness, kidney issues, or balance problems should automatically be pushed toward the same number. That leap is exactly where trouble starts. Now, before I give you a practical target range, if this is already changing the way you think about blood pressure, subscribe to Wellness Phase. Because one of the biggest problems in health information right now is that people are being handed numbers without context. And when you're over 70, context is everything. My goal here is not to scare you away from treatment. It's to help you understand when treatment is helping, when it may be hurting, and how to tell the difference. So what should your blood pressure actually be after 70? The honest answer is that there is no single perfect number for everyone. But there are patterns that make sense. In healthier older adults who are active, functioning well, and tolerating medication without symptoms, a systolic blood pressure somewhere under 140 often makes sense. And for some people, especially the robust ones, getting closer to 130 may be appropriate if it's well tolerated. On the other hand, for adults who are frail, over 80, or dealing with dizziness and standing blood pressure drops, a more conservative range may be safer. European guidance, for example, often discusses a systolic target around 130 to 140 in very old or frail adults if tolerated, while other geriatric frameworks allow even more relaxed targets depending on frailty and life expectancy. But here's the part most people miss. Your symptoms matter as much as the number. If treatment is making you feel dizzy, washed out, mentally slower, or unsteady, that is not a minor side effect to ignore. That is clinically meaningful information. In fact, balance and dizziness in older adults are often linked to medications or blood pressure-related changes, and the National Institute on Aging specifically warns that these symptoms can increase fall risk and deserve medical review. So if your blood pressure looks great on paper, but you feel worse in your actual body, that is not success. That is a sign the plan may need to change. There's also another overlooked point here. A lot of people assume that if standing blood pressure drops are present, blood pressure treatment must always be too aggressive. But the evidence is more nuanced than that. Recent reviews suggest that intensive treatment does not automatically increase orthostatic hypotension in every older patient. In other words, the problem is not simply medication equals bad. The real issue is whether the right patient is on the right amount of treatment with the right monitoring. That's why blindly lowering or blindly stopping medication are both mistakes. The target has to fit the person. So how do you know if your current target may be too low for you? Look for patterns. Do you feel lightheaded when standing? Do you avoid walking because you feel less steady lately? Do you feel worse after a hot shower after a meal or when you haven't had much water? Have you noticed more fatigue or brain fog after a medication change? Do you need to pause after getting out of bed or out of a chair? These are not random annoyances. They are clues. And in some people, they are the earliest warning signs that blood pressure is no longer being regulated safely from one moment to the next. Now let me give you one simple thing you can do at home. Check your blood pressure after resting quietly, then check it again after standing. A formal bedside method often uses several minutes lying down, and then a standing reading at about 3 minutes. But even home standing checks can help reveal a pattern worth discussing with your clinician. If the top number drops by 20 points or more, or the bottom number drops by 10 points or more, especially if that comes with dizziness or weakness, that's important. Bring those exact numbers and symptoms to your doctor, because standing blood pressure is one of the most useful pieces of information older adults can provide, and one of the most underused. And one final warning. Do not use this video as a reason to stop your medication on your own. Very high blood pressure still causes silent damage, and severe elevations can become urgent, especially if readings rise into the 180 over 120 range or come with chest pain, shortness of breath, headache, or vision changes. The takeaway here is not that treatment is wrong. The takeaway is that treatment after 70 must be individualized. For some people, 130 is protective. For others, the safest range may be a little higher. The goal is not the lowest number possible. The goal is the lowest number that still keeps your brain, heart, kidneys, and balance protected at the same time. If you remember only one thing from this video, let it be this. After 70, the best blood pressure is not the one that looks perfect on paper. It's the one that lowers long-term risk without making you feel worse today. That is a completely different question, and it deserves a completely different level of attention. In the next video, I'm going to show you the hidden signs that your blood pressure medication may be too strong, even if your doctor says your numbers look excellent.